arthrokinematics, right? I have different ways of revising the arthrokinematics. The one way is thinking of concave on convex or convex on concave, which means I'm thinking about the articulating surface of the joint, right? Articulating surface, as you know, is basically made by two bones, right? You know what? Before I dive into the into different things, how do you grade yourself in MSK from 0 to 10? Or let's put it that way. How do you grade yourself in arthrokinematics? Wow, I see 10s and 8s. That's great. Love it. How do you grade yourself in arthrokinematics? I think we're looking at the high numbers of an average of 6.5, if I'm not wrong. We have few 10s that increases our average, few 8s. Great. Yep, I think it's safe to say the average of today's group is about 6.5 or 7. Okay, perfect. So let's just revise instead of studying from scratch this concept. Let's look at the shoulder joint first. Right? Shoulder joint consists of multiple joints. It's a complex. The main joint is glenohumeral, right? Which is your convex on concave. So very quickly tell me in the chat, if I'm trying to improve external rotation at the shoulder, what is going to be my glide? External rotation. Very good. Anterior glide. If I'm trying to improve abduction on the shoulder joint, what is going to be my glide? Abduction. Inferior glide. Very good. That's great. How about retraction and protraction? If I'm trying to increase retraction, retraction is sternoclavicular joint. The clavicle and the sternum makes sternoclavicular joint. If I'm trying to improve retraction, retraction is the anterior motion of the shoulder. And that's going to be anterior glide because that's concave moving on convex. Very good. How about if I'm trying to improve shoulder elevation by mobilizing the sternoclavicular joint? If I'm trying to improve shoulder elevation, what is going to be my glide? Shoulder elevation by gliding the sternoclavicular joint. That's going to be your inferior glide. Very good. Because sternoclavicular joint is a saddle joint. When we go with retraction and protraction, it's concave moving on convex at the sternum and the clavicle. The clavicle moves on the sternum, concave surface over the convex. But when I go with elevation and depression, the convex surface of the clavicle moves on the manubrium, which means we're talking about opposite direction. Great job. How about scapulothoracic joint? If I'm trying to improve shoulder elevation and if I have scapulothoracic joint, what is going to be my glide? Scapulothoracic. This is how it moves. For shoulder elevation, that's gonna be superior glide because the scapula, the anterior portion of the scapula is concave over the ribs, the thorax. That's concave moving on convex, right? Look at that. So that's gonna be same direction of the glide. For elevation, that's gonna be superior glide. Very good. Great work. So that was about the shoulder joint, right? Let's talk about the elbow joint. Now, elbow joint, you have two different joints. One is your ulna would have a hook with your humerus, right? And then the next joint is radio-ulnar joint, where you have ulna and radius works like this, right? So when we speak of the elbow joint, the humerus and the ulna, you're talking about flexion and extension. And that's concave moving on the convex because you have a hook joint right there. All right. So if you're trying to improve flexion, what do you do? Is there an anterior glide on the joint? How do you give the anterior glide? Think about it. It's basically the distraction. Thank you very much for writing that, Priyanka. It's basically the distraction. Scooping, very good. Can anyone tell me what angle? What angle scooping? What angle? That's right. 45 to maximum 60 degrees. If you go beyond that, you will not be able to distract the joint. Great work. Convex on concave, when we speak of the radio-ulnar joint, if this is ulnar and this is radius, and this is how it fits. You can see right here. What movement occurs at the radio-ulnar joint? There, supination or pronation. If I have to speak of pronation, what is going to be the direction of the glide at the elbow joint for pronation? Pronation is the anterior movement, so that's definitely going to be the posterior glide or the dorsal glide. Very good. Good job. I can see why we had tens and eights for the arthrokinematics. Great work. Wrist joint. Wrist joint. If you do flexion and extension, right? Your carpals are moving on your big radius right here, right? So if you're trying to improve extension, what glide are you giving to the patient? That's going to be anterior or volar glide. If you're trying to improve the radial deviation, what glide are you giving on the carpals over the radius? Radial deviation. That's going to be ulnar glide. Very good. Great work. Okay. I think I need to move this right here. Okay, now when we speak of the carpals, okay, this is a little advanced, and mostly the hand therapists have specialization in mobilizing the carpals. For the entry level examination, you shouldn't be asked the carpal bones mobilization. But because when you start studying and you're like, oh, the next thing is carpal bones mobilization, shall I study this or not? So I made some summaries for you. All right. What I want you to focus on a few things when you speak of the flexion in the carpals and extension in the carpals. When you're performing flexion and extension, the carpal, very minimal movement in the carpals. What did we say in flexion? Carpals with radius. If you're doing flexion, you're giving dorsal glide, and the similar goes with the carpals as well. It's going to be the capitate and hamate, all right, because this is the second row, is the distal row of the carpals, capitate and hamate, which are going into the dorsal direction for flexion and going into the volar or the anteriorly for the extension. Okay. For radial deviation, it's going to be the same thing. It's going to be ulnar glide. And for ulnar deviation, it's going to be radial glide. But if you think of CH, capitate and hamate, are going to be moving more. All right? Because a slight movement, and again, it's something that you want to work with the hand therapist to work on this. So I wouldn't worry much about it, but just for your information, this is something that's easy to remember. Okay, very good. Phalanges. If you're trying to improve the flexion on my DIP, what do you think? If I don't have enough flexion at my DIP, what glide are you going to give? Flexion, concave on convex. and that's going to be anterior glide. All right. Very good, everyone. Now you have these slides. You can use it as your cheat sheet if you want to. But yes, very important to remember the arthrokinematics so that you can have a better view of how you're dealing with the patients.